I truly believe that every child should have a reflex screen because it's more common than not for a child to have, at least one retained reflex that's negatively impacting their ability to get through their day. That's what I found through the research. 75% of kids in the classroom have at least one retained reflex. For the 2-year-olds who were, 2 years old when the pandemic hit, everyone starts wearing a mask. They can't see facial expressions. They can't go to the park. They can't socialize. These are the kiddos who I think got hit the hardest here. We are simply here just saying that everyone needs their reflexes screen.
Welcome to All Things Sensory by Harkla,
your go-to podcast for practical insights on sensory processing and development from an occupational therapy perspective.
If your child was born in the years between 2018 and 2022, I think it is mandatory that they should have their primitive reflexes assessed.
Ooh, that's a pretty bold statement.
I know. I think it's a conversation worth having, though.
All right, let's have it.
Hey there. Welcome back to All Things Sensory by Harkla. I'm Rachel.
And I'm Amanda.
And we are occupational therapy practitioners who are passionate about sharing information and strategies that will hopefully change your child's life.
Okay, so what even are primitive reflexes and how has this impacted your own children, the clients that you work with? Like, what is going on here?
So primitive reflexes, we are all born with them. Ideally, we should be born with them. They're developed in utero, and the trick is these reflexes are natural automatic movement. They help keep us safe. They help us connect to our caregivers. They help us meet our milestones. But the trick is they have a specific timeline. So they should integrate or mature as the child develops, as those reflexes are almost like triggered. And so we want to see them integrate or go away. But for a variety of reasons, we see that these reflexes are being held onto, they're not integrated, or they are retained. So this can obviously impact kids and adults in a variety of different ways, just because it can impact things like social emotional skills, movement, coordination, anxiety. It can kind of keep them in that lower state of functioning, that fight or flight response, instead of being able to allow them to access those higher centers of their brain. They're stuck in that lower brainstem way of functioning.
Yeah, I feel like I heard so much. I had just started my career. I started as an OT practitioner in 2019. So around October of 2019. So I had only been practicing for about 6 months before I got furloughed from my job. I was working in a peds clinic and I was only on, what is it called?
PRN?
Yeah, I was on PRN at the time. And so I didn't really have good job security. But quickly, within like a month, I think they asked me to come back. But most of my career, I have experienced the post-pandemic children and clientele and all of that. And I know the biggest conversation around that time was like how much anxiety all of us, even as clinicians, carried with us, but the parents that were pregnant or had young children, and just the anxiety of the world that these kids were experiencing and how that could potentially have impacted their development and reflexes for that matter.
Exactly. And so I think the biggest thing that led me to, share that strong opinion online was that I just feel like, first of all, I think every child needs to have their reflexes assessed or screened just to rule out, any potential reflexes, because it's more common than not for a child to have, at least one retained reflex that's negatively impacting their ability to get through their day. That's what I found through the research. 75% of kids in the classroom have at least one retained reflex. Now, that being said, I specifically threw those dates out because for the 2-year-olds who were, 2 years old when the pandemic hit, everyone starts wearing a mask. They can't see facial expressions. They can't go to the park. They can't socialize. These are the kiddos who I think maybe got hit the hardest here age-wise. But those people who were pregnant during the pandemic, I found out I was pregnant in January of 2020. And then by March or like late February, it was like, oh my gosh, we're having a pandemic. And you just, everything changes. Like your whole plan kind of goes out the door and everything's unexpected. So my thought is, if we have an individual who is pregnant during the pandemic and all of those unknowns, that stress and all of those stress chemicals are flooding the body and obviously they're going to impact the fetus as well. So that being said, I notice it with my son. He's more of a sensitive kiddo, more of a fear paralysis kiddo.
Yeah. I wonder too, I mean, that all plays such a role, especially in that fear paralysis reflex that we've talked a lot about recently together. But I also think about just how little these families were really getting out. Like we were talking about that, like 2 and 3-year-old age range. Like if families were typically going to the library or the playgrounds or the swimming pool, those places where kids really learn to develop and get social interactions, everyone started working from home. So kids weren't really in daycare or preschool anymore. Parents were preferring to keep them home, to keep them clean, which to no fault to anyone, it was a really scary time, but these kids had a lack of social skills, movement, hanging from monkey bars, swinging, all of those good things outside. And of course that's going to impact their development.
Exactly. I'm trying to think like what would be harder having, for me personally, like having a 2-year-old at this time or having a newborn. And my thought is, potentially maybe some individuals wouldn't put their babies down on the floor because it's like it's dirty, or we can't, go out, and so we can't put them on the floor because of all the germs or whatever. But, on the flip side, maybe a lot of people did more tummy time with their babies too because they're home with them a little bit more. Or I don't know, if we're working from home and we're on our screens all the time and our kids are trying to get our attention and it's like, no, sorry, we're working, here, watch TV, maybe that also played a role in their development and maybe why they're struggling now.
Yeah, I definitely saw that a lot at the time. Throughout even 2021, 2022, I had switched to doing more of an early intervention position. So I was going into the homes of people in the Charlotte, North Carolina area, and we were still wearing masks in the home and the families were still wearing masks. And it was really hard for kids. We were just recently talking about this, but to read our emotions and to be able to read those facial expressions and to see our lips when we're making certain sounds for language development, like it was just such an odd time, and seeing it from all different perspectives, like the clinic and the in-home services and working with the newborns and 2 to 3-year-olds versus working with the older kids in the clinic. Like we really experienced and saw these kids during some of the toughest times.
Yeah. And another interesting thought that I had was if a child needed services like early intervention early on in the pandemic, they weren't able to get those services. So I feel like things were always delayed, services were delayed. And when you are working with a child and you have a mask on, it just makes things more challenging,
Yeah, I didn't even think about that. Like families just not wanting strangers to come into their home. So maybe if they would have originally sought out early intervention services, but because they were like, well, we don't know who this therapist is or, where they're coming from. We don't really want to be inviting people to our home. Maybe they had a sick elderly, individual that lived in their home and they're like, well, we can't really risk one way or another. So that's such a good point.
Yeah. And so I think just taking it back to, with the retained primitive reflexes, so much of that happens, so much of the development happens in utero, right? So if we are impacting fetal development, whether we know we are or we aren't, it's just a waterfall effect, right? Without necessarily thinking about it. I think about some of my clients who have come to me, and one in particular had worked in law enforcement, right? We talked about this earlier. And we, the kiddo presented with all of these like fear paralysis symptoms. And she's like, oh my gosh, I was in law enforcement. I was so stressed. And this is a kiddo who's, I don't know, probably a 2, 3, 4-year-old during the pandemic, couldn't go to preschool, couldn't go to kindergarten. And I feel like a lot of, maybe you can talk on this point a little bit more, the kindergarten class, those like COVID kindergartners.
Yeah.
My son, he's going to be in kindergarten this fall.
Yeah. As clinicians, it's super important to be able to use our parent interviewing skills to ask these questions of like, what was life like during the pandemic for you? What kind of job did you have? Where were you guys living at the time? Were you under a lot of stress during your pregnancy or during your child's early development? And this is not about blaming, mom or the family or the parents, but it's just getting really interested in what their whole life looks like and what development really looked like for them as a family, and being able to lead your intervention plan based off of that. Obviously, we're not trying to it's not always about just treating the diagnosis or the past, but looking at how all of those things could have caused, what's the root cause of what's going on.
Exactly. And there's not typically just one thing, another factor, I think, like we touched on a little bit, tummy time, but like containers and screen time, right? There's more bumbo seats, there's more bouncers, more jumpers, more, just containers that are raising our babies. Miss Rachel, we watched a lot of Miss Rachel. Love her. She's fabulous. But it's like, are those things replacing, or did they replace a lot of the interactions that babies should have been getting naturally?
Yeah.
It's a thought.
I mean, one, we were in the house all the time and probably bored. A lot of people were either laid off or they're working from home. So you're like, all right, well, we don't really have it to get a babysitter or a nanny. So like, Miss Rachel, you can definitely raise our kids for a few hours. You will keep their attention. They love you while we're doing this. Where nowadays, now that we're back into real life, we don't need to rely on those things quite as much. The world is still slowly starting to go back to normal in those pre-pandemic times. But it's so true. Like, we relied so much on screens and containers during those years to just get us through.
Yeah, exactly. And I also just feel like we're seeing more and more, at least I should say, I am seeing more and more kids who are showing a lot of the same symptoms of retained reflexes. And I feel like when I'm interviewing clients, it's a lot of the same things that they're noticing, and the patterns are pretty consistent, which is honestly what drove me to share this information in the first place. Not to scare people, not to fearmonger, right? But like, truly, I believe that if pediatricians were screening kids for retained primitive reflexes in their office visits, there could potentially be, there'd probably be more kids going to therapy, which is fine. But I think it's just, before we do X, Y, and Z, or try X, Y, and Z, like, let's just do a quick screen. It takes like 5 minutes to do. Oh, I'm noticing this. Okay, let's push you this way and, have you go see this provider, right?
Yeah.
I don't know.
And like early
Yes.
and often, around that 2 to 3, 4 year range before they get to kindergarten, because from working in the elementary school the last year and a half or so, it's actually very alarming. I had never worked in a school before, so I had never specifically worked in that setting, but it's alarming how many children now are on IEPs, and we're almost having to adjust the curriculum or our expectations of these children that are coming through. And I don't think that that's what we should be doing. We should be learning how to get these children back to the standards that we've always had for kids at this age, because the amount of kids that don't know how to read and write and that genuinely struggle with the underlying skills required for it is scary.
I'm glad that you brought that up, because I don't work in the school. I've never worked in the school setting before, but I can assume that what you said is true, because, you just hear about it, but it's nice to like actually hear it from someone who's been in the school, and you're like, it's happening right before my eyes, you know?
And they're 5, 6, 7, 8 are the ages of the children that we're seeing those things come through with. And I'm like, okay, yeah, let's think back. Okay, 6 years ago was when everything happened. So they are the prime age of our pandemic kids that we're seeing these issues with.
Yes. And I think, I talk about crawling a lot, obviously. And, let's say a baby didn't crawl, or let's say they didn't roll, or they didn't sit, or they didn't do these specific milestones. Maybe they weren't getting caught at the pediatrician's office as well. Maybe we just didn't know enough. And then they go and like change the milestones, which we have another episode on that. They didn't actually But it's like they're pushing back all of these milestones is what it seems like. So what we're finding is that people are thinking like, oh, crawling doesn't matter, or, oh, rolling doesn't matter. They don't need to roll in both directions before they learn to crawl. And it's like, unfortunately, there is a lot of that misconception. And that also can impact a child's primitive reflexes as well.
Definitely. All right, Rach, let's talk about some signs and symptoms that might be worth looking into, or that families or clinicians might be seeing that are like, ooh, okay, this might be related to something deeper.
Yes, love that. I think the biggest thing, well, it's tricky because every reflex has kind of its own set of symptoms. So just like overarching here, the biggest like quote unquote red flags here, anxiety, gravitational insecurity, mood swings, allergies, asthma, chronic illness, reading challenges, vision challenges, ocular motor challenges, handwriting, balance. Can your child ride a bike? Can they swim? Can they play a sport? Are they coordinated? Are they not?
Can they crawl?
Can they crawl? Can they skip? Can they jump? Can they do a cross country ski or a cross crawl? So really just looking at their overall ability to function in society,
Yeah.
Do you have to do everything for them? Are you modifying? Are you still wiping their bottom? I don't know. I just think it's important to keep that in mind as well when you're looking at their ADLs and their IADLs. So yeah, if you're noticing those things, whether or not you had a pre or post or during pandemic baby, when in doubt, rule it out, right? I'm literally living this motto right now because I'm like, oh, what would you do, Rachel, if you were a clinician and it's your own kiddo? And I'm like, oh, well, when in doubt, rule it out.
Yeah, you're like, I would take her to get a vision screen.
Yeah, exactly.
I would, take them to a developmental, pediatrician. I would take them here. I would take them there. Like, it is important to follow up with specialists. And sometimes the pediatrician is a great place to start, but like we were talking about, sometimes they are not the experts.
They're not trained in this.
Yeah. And they're not screening for it. And so it's okay to ask them like, hey, do you mind giving me a referral? I'm a little concerned about this. Maybe we should go see a developmental pediatrician. Maybe we should go see an OT. What do you think about that? And I'm sure your pediatrician will be like, oh yeah, like if you're actually concerned, like I'll send the script right off for you.
Yeah, definitely. And that's really important too, to know, to advocate if you do have concerns, or if you're like, I don't know, I'm just kind of curious. Like, let's get a screen, let's get an assessment, let's just see what we're looking at.
Yeah.
I'm like, why not? It's
Yeah.
not going to hurt. And then you'll have that information and then you can, move forward.
Even as like from a clinician standpoint, for all of the OTs that are out there listening, is it something that we should be also asking the pediatricians about? Like, if we have a child that comes through our clinic or we're in their house and we're seeing these things, is there something that we should be talking to the pediatricians about, like reaching out to them for the families if they don't know what to ask for?
Yeah, I think always. I think it's a great option, and to even like open that line of communication. Like, I did a lunch and learn at a pediatrician's office way back when, explaining like primitive reflexes, and they had no idea. They had no idea. They knew about some of them just from like, coming back after like having a stroke, like that type of primitive reflex, but not developmentally in their clients. Did they know what to look for?
Yeah.
Which, we've got our work cut out for us.
We do. That was just turning wheels for me, but like, how can like clinic-based or even school-based OTs be going to the elementary schools and the preschools like this summer before schools get started back up? How can we go and present lunch and learns to them at the beginning of the school year to help teachers be more aware of what to look out for and implement? Okay, can we implement a crawling program? Can we implement something, metronome activities? What can we be teaching these early education teachers that they can quickly and effectively implement to help overcome these, especially if these kids might not have access to daily therapy?
Exactly. Like I said, kind of taking this back full circle, I truly believe that every child should have a reflex screen. I just said these years because they're a little bit more intense, but I'm really just not saying this to like freak anybody out. Just being a clinician in this space and specializing in reflexes and sensory, I just am like, it's not going to hurt to have the data.
Yeah, I was just thinking that,
You
like,
know?
what's it going to harm? Maybe your child is like the best kid we've ever seen. Heck yeah, that's awesome. Move on with our day.
Exactly. The more information, the better. And the earlier we start, the better, of course. So, keeping in mind that the brain is plastic and it's malleable, and you can always work on integrating these reflexes no matter how old you are. Heck,
Yeah.
I still work on them myself, you know?
And I definitely think, like, a note for all the therapists out there, because it's still, I don't know, taboo might not be the right word, but I feel like reflexes are one of those things that, like, we all like know about, but might not know about. Like, do we actually learn about them like as much as we should in school? Like, we always have to take extra courses and things to learn about this more in depth. But as a clinician, if you are working with children that are coming in with any type of delays or deficits, you should be doing a screener on these kids. Like, you don't maybe have to go through like super in-depth knowledge and testing of every single reflex, but there should be those quick, like, Superman, popcorn, jumping jacks, that quick list of things that you should look at right off the bat to be like, okay, yep, there might be something more in depth. And if you are not trained in reflexes, find a course, ask your employer if they would like to,
Sponsor you.
to get it done so that you can better support your clients, but also refer them to someone that you feel like can better support them is always okay.
I feel like a really important part of my career being an occupational therapy assistant was if someone asked me a question, especially early on, and I didn't know the answer, I was always like, hey, I don't actually know the answer to this. Let me do some digging and get back to you.
Yeah.
And then that just like snowballs into, oh my gosh, okay, let me look about this. And then we just are always learning.
Yeah, that's what I mean. I'm obsessed with podcasts and YouTube and all the things, especially my first few years as a clinician. Every single day, to work, after work, I was constantly looking things up. What's an exercise for this? How can I help with this? How do I explain this to parents? Like, it's just important. And we're not going to know it all. And you don't have to have imposter syndrome if you don't know all the answers right off the bat. There's always room to learn more.
Okay. When did you start listening to our podcast for the first time? Do you remember?
Honestly, I've been listening for a few years.
Because if you graduated in 2019, we started it in 2018.
Yeah, I feel like back in 2019, I wasn't as into podcasts as I was.
They were new.
Yeah, looking up YouTube videos on things so I can like get a visual piece of it. Back then, I needed the audio, the visual, all the things to fully understand what was going on.
Yes.
But probably in like 2023.
Oh my gosh, that's so fun.
Yeah, it's so fun because I was working in early intervention, so there was a lot of like sensory.
Yes.
Every kiddo that we got was sensory.
Yeah.
So I was always looking at questions.
Rightfully so, right? Yeah.
I've been obsessed for a long time. So
oh my gosh.
Yeah.
I love that.
What a full circle moment right here.
Okay. In closing, this is not about fear. This is about curiosity. We are not here to, over pathologize this generation of kids. We are simply here just saying that everyone needs their reflexes screened.
It's true. And I think the both of us and all clinicians out there would much rather screen a child and make sure that there's nothing underlying going on than miss out on something that could be a huge building block for those later, more important reading, writing skills down the road.
Exactly. So if you're listening to this and if you have a child who was born in between those years specifically, feel free to drop a comment or send us a message or screenshot this and share it and just let us know your thoughts. Like, do you notice any of these things, or are your kids thriving? Which, like, either way obviously is fine, but I'm just curious to hear some other opinions on this.
Yeah, please leave a comment. I would love to know where you're at. Maybe where did you live? What country did you live in? What, how old were your kids? All of the details, give them to us. I mean, we should do like a full research study on this. So, give us.
Don't tempt me with a good time.
Give us the information so we can start gathering the data on this, because I think we're going to have some crazy findings.
Yeah. And definitely share this episode with someone. in a kind way, of course. And with that, we'll plan on seeing you back here next week for another episode.
Okay, bye.
Thank you so much for listening to All Things Sensory by Harkla.
You can find links and resources from today's conversation right in the description of this episode.
If you want to connect, ask a question, or share what resonated with you, come find us on Instagram at All Things Sensory Podcast. We'd love to hear from you.
As a podcast listener, you get 10% off your first order at Harkla. Just use the code SENSORY at checkout or head to harkla.co/sensory to get started.
We're so grateful you're here and honored to be a part of your journey.
Everything we share here is for educational purposes only and reflects our professional experience. It isn't medical advice. Please consult your healthcare provider for support specific to your child.
Thanks again for listening, and we'll see you next time.